bread, your eyes go red. All there is, it's just smoke in the head. As were your deeds, so is your fate. A life full of denial, anger and hate. So don't do drugs, get smart. Today's a new day, go get a fresh start. Thank you.
I'm Faria. I'm from the main campus, and I'm trying to separate questions from facts. I'm trying to answer questions with facts. And even though we make quick judgment calls about drugs, there's a lot of questions. Question number 1. What is youth? According to the United Nations, every person between 15 and 25 years of age falls into the category of youth. And according to the US Census Bureau, there's 34 million people plus who are youth in Pakistan. The only people who exist in wider numbers are children. And in a country where many children don't go to school and most children never get to secondary school, youth doesn't mean what it usually does in the Western world. Here, youth has jobs. Youth earns money. And many times, youth could be married. Youth could have children. Here, youth is adult. We end up with people who are young enough to be youth, but in our country, old enough to have the responsibilities of adults, old enough to have the incomes, the disposable incomes of adults. And in the case of drug addicts, the saddest case is when they're old enough to have children. Question: what's drugs? Why are we concerned with drugs? Fact: no one's concerned with drugs. Everyone's concerned with drug abuse. Abuse is something everyone understands. It translates into every facet of life. And that's a good thing, because sometimes the term drug, the term addiction, doesn't translate quite so well. Imagine someone telling you that your habit of watching TV for an hour every night before you go to bed, just to relax, just to have a little bit of fun, is an addiction. You're abusing your television, you're abusing your technology, you're going to hurt yourself. They sound ridiculous. It's just TV, I'm relaxing, I'm having a little fun. That's the same way a lot of us think about cigarettes. That's the same way some of us won't admit, but do think about alcohol. And that is the same way that a lot of our lesser educated countrymen think of drugs. It's just relaxing after a hard day of work. Fact: drug abuse is not relaxation. Drug abuse is too elusive for our own good, and drug abuse is irrevocably abuse. What can happen when you have a few 100,000 drug abusers in your country? We're a country of millions of people. We're chronically overpopulated. A few thousand people, come on, I mean, really, is that such a big loss? Case in point, Botswana is an African country with 300,000 victims of AIDS. That's not a very large number compared to the overall population of a country. We have 15 million people in Karachi. But for 300,000 victims of a disease, okay? This wasn't their fault. This is a disease. There's 95,000 children who may not have a parent and who definitely don't have access to education, which is a luxury. Don't have access to sustenance, which is a necessity, and don't, in any meaningful sense, have access to their childhood. That's the cost of 300,000 people with a disease. Pakistan had 3 million people with drug addiction. In fact, let's clarify. Pakistan had 3 million people officially estimated with drug addiction 15 years ago. Since then, we've earned a lot more money, and we've gotten into a lot more problems. Fact: right now, Pakistan has the perfect deathly combination: the excuses to use drugs and the money to buy them. Question: most people who can afford drugs are just spoiled rich brats whose parents whose parents have too much money, too little time, they don't spend time with their children, they don't give them good morals, that's why they go into drugs. The average person can't afford food, how can they afford drugs? Fact. To feed 40 people, you probably need to get what, 4 days of biryani? To get 40 people high on hashish, you need to get 25 grams of the stuff. It costs 1,000 bucks, rupees. Dinner for 4, really good dinner, 2,000 rupees. Ketamine for 4, 15 rupees. And if you're really throwing a good party, instead of taking everyone out to a gourmet restaurant in a 5-star hotel, which could cost you upwards of 10,000, 20,000 rupees for one meal for 6 people, you can get 8,000 worth of really good Coke. Not the bottled kind. That costs you about, 8,000, 6 people. Fact. We can afford drugs. Question. Why do we buy them? That's for you to answer.
Ladies and gentlemen, now I'd like to invite Sarah Sohail, who's going to talk about how drug abuse can be prevented.
With more than 500,000 drug users, Pakistan has among the highest addiction rates in the world. It has now become a serious social problem which affects the drug user himself, his family, and the community at large. So who are the people in our society that are most vulnerable to this social evil? The answer to this unignorable question is anyone who is depressed, feels that he is a victim of ever-consuming evil forces, does not have proper guidance, or simply bows down to peer pressure, or is underemployed, or in some cases unemployed. Additionally, drug use is on the rise among younger age groups who are becoming a large part of the street drug subculture. These also include street children who increasingly consume drugs, living precariously with little or no family support or guardians. Now, what can we do at our end to stop this sort of drug addiction? Possible solutions are to understand them at society level. The government must show more sensitivity to the issue by examining ways and means to discourage drug users. The public needs to be sensitized so that addiction is treated as a harmful habit. It is only from a common platform that we can come together and do this. The addiction of drug users is a habit few can break free of unless it is treated as a medical one that can be corrected through counseling and intensive rehabilitation programs, of which there are just a handful across the country. With the globalization of the drug abuse problem in the last 2 decades, the situation has gone from bad to worse. So much so that the United Nations Commission on Narcotics Drugs no longer discusses individual solutions. It has to be worked on through mutual effort, not just amongst the South Asian countries, but amongst households as well as individuals. Thank you.
Hello everyone, I'm Zunaira Sohag from BBMIS 5. We all know that young people have enough power to make life better for their families, friends, communities, and most importantly for themselves. Drug abuse significantly contributes to the rising healthcare costs as well as the societal problems. Well, the good news is that drug abuse can be prevented, but the prevention of drug abuse is not easy. There are no quick fixes, and a media campaign is not enough. Not one single intervention can help to reduce drug abuse or its use for everyone. Hence, there should be some characteristics of programs which have been defined for its success. Now, I have divided the intervention necessary for prevention of drug abuse as family-focused, community-focused, and education-focused.